Hello, everyone, and welcome to the session on mind-body interventions. This Living with Lymphoma breakout session will provide patients with a better understanding of the scope and characteristics of the mind-body interventions and their use throughout cancer care to help lymphoma patients learn how to manage emotion, psychological, physical, and practical impacts of their diagnosis and treatments. We appreciate those of you who are able to join us live today. And before I introduce today's speaker, I would like to provide a bit of guidance about how to use the Zoom software. This virtual software does not allow you to share your video or microphone. And if you have any questions, please save it for the end of the session for the Q&A. You can type your questions into the Q&A section that is found in your toolbar, and your questions will go straight to the moderator to ask the presenter live. I would now like to introduce and welcome our speaker, Chelsea Moran. Chelsea is a PhD candidate in clinical psychology and Vanier Scholar at the University of Calgary. Before beginning her doctoral studies, she completed her BSc in psychology at University of Ottawa and master's in counseling psychology at McGill University. Her research focuses on identifying effective ways to promote, adhere to health behaviors among individuals with chronic illnesses. She also conducts research on coping with cancer using cognitive, behavioral, and mind-body interventions. As part of her training to become a clinical health psychologist, last year she completed a clinical practicum in I always ruin this word, sociological oncology at the Tom Baker Cancer Center in Calgary. Through this experience, she worked with patients with lymphoma and other hematologist cancers along with their caregivers and families. We thank you all very much for joining us today to speak on this important topic for all of the cancer patients, and in particularly for lymphoma patients. I would now like to turn the presentation to you, Chelsea. Thank you, and please take it away.
Great, thank you so much. I'm so thrilled to be here to share some information with you all about mind-body interventions, what they are, how they work, and how you can use them. Even after this presentation, I'm hoping you'll leave with some practical tips on how to use them to cope with cancer and other stressors in your life. And I'm really curious to hear during the Q&A today kind of what you think about all this as well. So before I get into things, I realize that we're logging in from all across Canada, but I would like to acknowledge the traditional lands that I live and work on here in Calgary. And also to acknowledge that, as a Canadian with European descent, I am a settler on this land. So I'd like to acknowledge that I live and work in a sacred place within Treaty 7 and the current and traditional territories of the Niitsitapi from the Blackfoot Confederation, including the Siksika, Piikani, and Kainai nations, the Stoney Nakoda of the Chiniki, Bears Paw, and Wesley nations, and the Dene of the Tsuut'ina Nation. Southern Alberta is also home to the Métis Nation of Alberta, Region 3. And I'd also like to acknowledge the traditional Blackfoot name of the place where I live is Mohkinstsis, which we now call the city of Calgary. And as I said, I know not everyone is probably located in Calgary right now, so I'd encourage you to kind of take time to think about whatever traditional lands you occupy, wherever you are. If you're not sure, I invite you to Google it to learn more about it. But I think it's, this has been identified as an important first step towards recognizing our own complicity in upholding colonial systems that benefit some people but harm Indigenous peoples. So I wanted to provide you an agenda for the presentation today, just to give you a sense of what I'll be covering, just in case if it's not exactly what you were expecting or looking for, you have time to leave the session and join another breakout room, which would be totally fine if that's the case. But really the purpose today is to give you some background on how mind-body interventions work, what the mind-body connection even is, and what some of these interventions look like. And really the purpose too is to kind of see if anything piques your interest, just to see if it's something that you'd like to pursue going forward and try to find resources to help you integrate these practices into your life. And I'll just acknowledge that some of the slides and information that I'll be presenting today were adapted from previous talks by psychologists that I know who are my mentors. So Dr. Linda Carlson, Dr. Sarah Beatty, and Dr. Laura LaBelle, who are all experts in the psychosocial care of people with cancer. Okay, so just to start off, I just wanted to provide a little bit of a setting the stage piece here about the emotional impacts of cancer and lymphoma and CLL. Because the emotional piece, of course, I think we're getting better at addressing it, but it can sometimes be maybe not as highly prioritized as all the other pieces that come along with the cancer experience. And everyone's experience is so different. So some of the stuff may or may not apply to you, but I'll just kind of give you some facts about what we know generally from the research and from our own practice about how cancer and lymphoma can impact an individual's well-being. So I think I just wanted to start by talking about stress and distress, because I think these are terms that we hear a lot and we talk about a lot, but just to make sure we're all on the same page about what they mean, because these are important targets of mind-body interventions. So psychological stress is what people feel when they're under mental, physical, or emotional pressure. And of course, it's normal to experience stress from time to time. And in fact, it's quite necessary. I think maybe most of us wouldn't even have logged on today if we weren't to some extent stressed about something or motivated in some way by our stress to learn more about lymphoma or talk about lymphoma, for example. So where it gets problematic is when we experience recurrent or chronic stress, especially if there's multiple stressors impacting someone at the same time, that things feel quite high stakes, and that can lead kind of that normal or healthy stress to turn into distress. So what I mean by distress is when people feel that they are unable to manage or cope or control changes caused by cancer or other stressors in their life. This can lead people to feel overwhelmed, anxious, experience lots of psychological and physical symptoms like headaches or tension or insomnia or anxiety or depression or a host of different things. So kind of chronic stress leads to distress or can lead to distress. But another factor that goes into this equation to explain how stress can lead to distress is your perception of your ability to cope with stress or the stressor. So if you're faced with a stressor and you perceive it as being overwhelming or insurmountable, and you perceive yourself to be hopeless or helpless in the situation, then it's more likely that stress will cause distress. So it's also an important aspect. And I think what's important about, not only mind-body interventions, but kind of self-management strategies that are within your own control is that it helps increase your perceived ability to cope. So although we can't necessarily remove the core stressor of cancer, for example, what we can do is increase our ability to, or our confidence in our ability to cope with some of the emotional impacts. So when we talk about distress, specifically with lymphoma or CLL, we often talk about these different experiences of emotions happening. So some of these are maybe experienced by people in general, and some are maybe more specific to cancer. And this is based on previous research. And also, I've heard a lot of these themes with my own patients that I've worked with lymphoma and their caregivers. So things like, of course, fear of the future, uncertainty, fear of disability and death and pain and relapse or deterioration. We often see as well a shift in how you feel about yourself, about your body. So your body image, how you perceive yourself, and maybe feeling a bit violated by having had this illness, or maybe not trusting your body's ability to keep you healthy as much anymore. So a lot of kind of emotions can come out of that as well. And those are the ones that are listed on the right side of the screen here. And I'm sure I don't need to sit here and tell you, what it's like to go through this process. I'm sure you have a lot of firsthand experience with some of these things. And it's just to point out that it's something quite normal that a lot of cancer patients do go through. And the last point here on the slide is, I don't want to erase the fact that some people do report that the cancer experience kind of results in personal growth for them and has some positive impacts, which is fantastic. And at the same time, I think I don't want that to overshadow kind of the difficult emotions that can come out with cancer. And again, just to kind of give you a sense of how common distress is with cancer, this is a recent study that was done using data from the US from 55 different cancer centers. And so they collected information from about 4,600 cancer patients And 46% of the sample here had distress symptoms that were in the clinically meaningful range, which means that they were severe enough to be that we would recommend that they seek professional attention or help in order to manage that distress. And within the sample, there were just over 200 patients who had some form of lymphoma. So just to speak specifically to the lymphoma experience, the study found that about half of women with lymphoma in the study and almost 46% of men with lymphoma in the study had clinically significant distress. So a little bit higher levels of distress compared to the whole sample in that way. And the point of all this is just to share that having these feelings is quite common, and it does impact men and women similarly. I also want to acknowledge the impact of COVID as an additional stressor added to the picture more recently. And there's emerging research on this. And of course, all of you have experienced what it's like to have cancer in the age of COVID. But there's a lot of emerging research on lymphoma specifically. So for example, I found the study that was published recently from a hospital in Italy, and they found that their patients with lymphoma, 3/4 of them said that their worries had increased during the pandemic. So that not only did they have to worry about the cancer piece, but also all these factors related to COVID, like worrying about getting COVID when they go to the hospital or bringing that home to their family. So again, just to acknowledge that it's an additional stressor that may increase our susceptibility or vulnerability to distress in this difficult time. And I also just want to acknowledge caregivers, because I think a lot of the emotional impacts we talked about earlier can impact not only the person with cancer, but also their loved ones and people caring for them. And everything that I talk about today in terms of strategies to manage stress and distress can apply to caregivers as well. And this is just kind of it's not an exhaustive list for sure, but just a list of some of the challenges and benefits that some of our patients and caregivers in the hematologic unit, where I did my placement last year, were reporting to us. So challenges like, difficulties prioritizing self-care and balancing all the different demands in their life, but also reporting some benefits. Some say that they find some caregivers find new meaning in life, or a new strength or a new skill that they didn't know they had before because they didn't ever have to do this kind of work before. So just kind of to keep that in mind and acknowledge that this talk is for caregivers too. Okay, so now to talk about the connection between our mind and our bodies, just to give you an understanding of why that matters and how these interventions work to capitalize on that. So the mind-body connection, when we say that, we're referring to the complex relationship between our minds and our bodies. So how we think and feel can influence our physical health and our well-being. And our physical health and well-being can influence how we think and feel. So it kind of goes both ways. I think headaches and stomach aches are a good example of this connection, because sometimes when we feel very stressed or very anxious, we may have a headache or have a stomach ache. So that's the mind influencing the body. Or if we feel we have a headache or a stomach ache for some other reason, due to treatment or some impact of cancer, for example, that might make us feel mentally unwell and fatigued. So that's the body influencing the mind. And this mind-body connection is a central idea to many non-Western medical traditions, like traditional Chinese, Tibetan, Greek, and Ayurvedic medicines. So just again, to acknowledge that a lot of the stuff that we'll be talking about today is borrowed from those traditions. So just to come back to the idea of stress mentioned earlier. So a crucial part of the connection between the mind and the body is how to manage stress. Or how our body manages stress. So there are a lot of different systems involved and that are activated when we're exposed to stress or to a stressor, and they all communicate together to create the stress response. So systems like our nervous systems, our immune system, which protects our body against infection, and the endocrine system, which is the system that makes hormones, that helps our cells and different parts of our body talk to one another. So I'll mention a few of these systems in the next couple of slides, but mostly I'll be focusing on how the stress response influences our nervous system and our endocrine system. So the stress response is mainly controlled by a part of our nervous system called the autonomic nervous system. This is the part that communicates with our internal organs and our glands. But this system has two branches that are really important when we're thinking about this mind-body connection. The first is the sympathetic nervous system. This is involved in preparing the body for stress-related activities, so activating our fight or flight response. And if you haven't heard that term before, that it just refers to our body's ability to quickly mobilize energy in order to either fight a stressor or a danger that we perceive, or to run away from it. So the sympathetic nervous system is really important for activating us. Then we have the parasympathetic nervous system, which is associated with returning the body to routine day-to-day baseline. So we often refer to the function of this system as rest and digest. So kind of really the system responsible for helping us to relax, especially after our sympathetic system was activated. So another way to think about this is the sympathetic system allows us to hit the gas, while the parasympathetic system helps us hit the brakes. And we need to be able to fluctuate between these two, because as I mentioned before, it would not be good to never be stressed, but we also need a system to turn our stress off to minimize the impacts on our body and on our quality of life. And I just wanted to provide you with a bit more information about the fight or flight response and what happens in our body, because especially when our sympathetic nervous system is activated when we encounter a stressor. So as I said, the purpose of this response is to get us ready to act quickly, to either deal with the stressor or to run away from it. And I don't want to turn this into a biology class or anything like that, so I'll keep it short. But essentially, when you encounter a stressor, there's this whole cascade of things happening, going from your brain all the way to your kidneys. And essentially what happens is your brain signals through different hormones for your body, for your kidneys, or glands on your kidneys, the adrenal glands, to create stress hormones. So hormones like cortisol, which is the main stress hormone that kind of circulates through our body and prepares us for the stress response. And also through a similar system, adrenaline, which is responsible for kind of that adrenaline rush feel you might get, especially when you're faced with danger. And the important part to point out here is this purple arrow, is that the way that our bodies modulate the stress response is using cortisol as the stress hormone as kind of a thermostat. So as cortisol concentrations go up in our blood, it kind of tells our brain to start slowing down the stress response. And that's kind of how we regulate that in a normal, healthy stress response. And what all of this does is, again, it's preparing our body to fight or flight. So it's increasing the sugar in our blood, so we have more energy. It's increasing our blood pressure, our heart rate, our respiratory rate. It's also suppressing systems that we don't really need in that moment to fight off whatever's happening. So it's suppressing our digestive system, our immune system. It's suppressing our tendency to seek out rewards and be motivated that way. And overall, just increasing our vigilance and arousal. So this is what a normal stress response would look like. And the human stress response is intended to be very transient, very temporary. It's not meant to be kind of activated at all times. So that's what we mean by short-term stress, would be kind of this response that we just talked about. So arousal in the nervous system, these stress hormones are released, and that gives us our fight or flight reactions. But then when we're exposed to long-term stress, so kind of that chronic stress that we talked about earlier, it can result in a dysregulation in that stress system and can have an impact on our physical health and our mental health. And this is because when our stress hormones, like cortisol, are perpetually elevated, that thermostat that I talked about doesn't work as well anymore, because it doesn't work as well to remind our body to calm down and to put the brakes on, which can then burn us out a bit faster. So some of the effects of long-term stress resulting from chronic elevation of stress hormones are suppression of the immune system, impairment in different systems, and also might result in us using other ways to cope with the stress that may not be very healthy for us. So for example, turning to substances to help manage our stress. So this is where mind-body interventions come in. So these are ways to minimize and manage the impact of chronic stress on the body. So these interventions are a variety of techniques that are supposed to work on a physical and mental level. They're designed to enhance the mind's capacity to affect the body's functions and symptoms. And they really capitalize on this interconnection that we talked about from all these different systems involved in our stress response. And the principle here is that every state of mind has a state of body, and vice versa. Every state of body has a state of mind. And these interventions are meant to complement more kind of traditional Western medical or psychological interventions. And really to paint the picture on where mind-body therapies might fit into the greater treatment picture. Of course, with cancer, with the stress that comes with cancer and the symptoms that come from the cancer or the treatment, things like nausea, sleep disturbance, fatigue, pain, they also have to be managed to provide optimal quality of life. And traditionally, our approach to this is using pharmacological treatments, using drugs or other substances. And, this works for a lot of people. It's a really important part of the management of these symptoms. And at the same time, some people may prefer to not rely on drugs so much, or some pharmacological treatments, like we heard in the session just before this one, can, create side effects that then have to be managed with more drugs and can interact with other medications and cause all these side effects that are not, really helping the overall quality of life picture. So this is where mind-body techniques or therapies can come in, again, as a complementary approach to using drugs, not to replace them necessarily, but to provide you with more options as to how you can manage these symptoms. Because again, we talked about how feeling like we're out of control or we don't have, we're not able to cope with a stressor is a huge part of distress. And so having these options available to you will help you feel more in control of a situation that probably feels really out of control. So how these interventions work is they help reduce the sympathetic arousal of our nervous system and increase parasympathetic arousal. So kind of going back to our gas pedal, brake pedal analogy, it helps us take the foot off the gas and also tap the brakes a little bit. And a key part of mind-body interventions and how they work is through breathing and through our breath, because our respiratory system actually is very closely related to these two aspects of our nervous system. And what's great about breathing is that in most cases, we can control our breathing. So if I ask you to breathe faster or slower right now, you probably would be able to do that. And so it's under our control and can be regulated by our minds. And in some traditions, breathing is seen as the link between the mind and the body. So that's why we'll be talking about that a lot today. So mind-body therapies include a wide range of techniques. Some emphasize the mind more as a way to impact the body, and some emphasize the body as a way to impact the mind. So I'm sure you've heard of some of these before, but perhaps you just haven't recognized them as mind-body therapy. So things like relaxation, mindfulness, meditation, hypnosis, yoga, Tai Chi and Qigong, and creative therapies like music therapy or art therapy. And then there are therapies that are more focused on the body. So things like acupuncture, massage therapy, Pilates, spinal manipulation, and I'm sure other things that I've forgotten to add to this list. So just to say that I'll be focusing on the mind part of the therapies today, because that's my knowledge and expertise as a psychologist in training. But just so you know, there are other options out there that other healthcare professionals are more trained to talk about. And if you're interested in the research evidence behind any of these approaches, I won't have too much time to go into that in much detail today, but I have included at the bottom of this slide a recent article done by Dr. Linda Carlson and her team out of the University of Calgary, which you could consult if you'd like. It's a recent review of all the evidence for most of these therapies. So you're welcome to look that up if you're interested in the research behind it. Okay, so starting to talk about relaxation. So relaxation therapies are techniques that are designed to elicit a state of freedom from mental or physical tension. And the idea here is that symptom improvement occurs as a result of eliminating that tension, which then helps with emotional stressors, helps with sleep, and has been shown to reduce pain in some studies. And it does this by, again, activating that parasympathetic nervous system, so helping us put on the brakes. And I'll walk you through 4 different types of relaxation activities that you can practice at home in the next few slides here. But just to say, these kind of applied relaxation techniques are a little bit different than passive relaxation techniques that we might be more typically familiar with. Like, for example, sitting down to watch TV or listening to music is kind of more of a passive relaxation state. But in this case, you're kind of actively doing something in order to relax. Before we get into any specifics, we have to talk about breathing, and specifically diaphragmatic breathing. And as I mentioned, this is because it's a key principle across all of these mind-body therapies. And this might sound a bit funny, but there's a very specific way we need to be breathing. The quality of breath is very important in order to help deactivate that fight or flight response and help with difficult thoughts and emotions. So diaphragmatic breathing is a way to deepen and lengthen our breath in order to induce greater relaxation and tension reduction. So the idea here is that our diaphragm, which is an organ kind of right below our lungs, the movement of that diaphragm is what activates our parasympathetic nervous system, our ability to put on the brakes. So we have to make sure that when we're breathing, we're moving the diaphragm. So the idea here is that, let's say you're taking a breath in, you're inhaling. What happens is your lungs fill with air. Your diaphragm then gets shifted down in your abdominal cavity, and then your stomach, your belly expands. So that's what's in the picture on the left-hand side here. And then when you exhale, your lungs contract because they're kind of getting emptied from air. Your diaphragm moves up because it has more space, and then your abdomen goes in, so it contracts. And that's what diaphragmatic breathing is. We have to make sure that we're breathing through our belly. So making sure that the abdomen is expanding and contracting when we breathe, rather than breathing through our chest, which I think is what we're maybe more likely to do, especially when we're feeling anxious, which is great to, we need to breathe. So whichever way we're breathing is great, but it's not very helpful to breathe through your chest when it comes to relaxation. So just to make this a bit more concrete, we'll practice it together. So even if you've heard of this before and tried it, I invite you to try it right now with me if you're interested. Also totally fine to sit this one out and take a coffee break if you prefer. But for those of you who'd like to join in, just make sure that you're seated. Either if you're in a chair, both feet flat on the ground ideally, but if you happen to be sitting on the ground, you can cross your legs like the person in this picture here. And at any point in this, if you begin to feel dizzy or lightheaded, just stop and go back to your normal, natural way of breathing. So what I'll invite you to do is, just like the image on the right-hand side here, is to place one hand on your chest and one hand on your abdomen or on your stomach. And what we're going to do is, as you inhale or take a breath in, you'll inhale through your nose and push your belly out as you're breathing. So making sure that the air that's coming in is kind of coming in your lungs like a balloon, and then pushing your belly out. And you'll know that this is happening because your bottom hand is right there to feel it. And you'll be able to feel that pressure of your abdomen, of your stomach against that hand. And then as you exhale, you'll let your abdomen fall back in. So that hand on the bottom goes back to its original position. So throughout all of this, the top hand on your chest should not be moving much or at all. And that's how we make sure that you're kind of double checking to make sure that you're breathing through your belly. So we'll do a couple together. So keep those hands on your chest and belly. And as you breathe in, just imagine that your stomach is a balloon. So we'll inhale for 3 counts and exhale for 3 counts. And we'll do that a couple times just so you can get the hang of it. Okay, so I'll invite you to just, get settled in your seat, put your hands, one on your chest, one on your abdomen, and we're gonna breathe in for 3 seconds, starting now. So breathe in, 1, 2, 3, and breathe out, 1, 2, 3. Breathe in, 1, 2, 3, and breathe out, 1, 2, 3. And we'll do one last more just to make sure you're having that movement on your bottom hand on your belly. So breathe in, 1, 2, 3, and breathe out, 1, 2, 3. So hopefully you were able to get some practice with that. It's kind of hard since I can't see any of you. Hopefully I wasn't just doing that on my own. But really, this is the core skill. If you take one thing home today, I would say remember this specific exercise, because this is a core skill across all mind-body interventions. So now that we have that skill down, we're going to add a little bit of something to it. And this is what we refer to as guided imagery. So guided imagery involves using your imagination to create some type of sensory experience. And the reason that this works is that your body can't fully discriminate between sensory experiences that are generated by your mind or that are actually there in reality. So an example of this maybe would be like, say, maybe you've read a recipe once and then you started salivating as if you were hungry. There was no actual food there, but your body reacted as if there was food there. So all this to say, this active imagination of a place of relaxation that you have, kind of a happy place or a place where you felt truly relaxed and safe, is something you can easily add on to that breathing that we just talked about. The key thing here is to fully imagine that place, whether it's the beach or the cottage or the cabin or someplace in your home that you feel very safe and comfortable, or a number of different things. The key here is to really imagine all of the sensory experience. So imagine what you would see if you were there. Imagine what you would smell, what you would hear, what you would feel from your skin touching, let's say, how the sand would feel between your toes and so on. And this is a way to help reduce, anxiety, depression, and discomfort, and to improve pain control as well. Next is a slightly different and a little bit more active relaxation strategy called progressive muscle relaxation. So this is the idea, or it's based on the idea, that when our muscles are tense, we're more likely to feel unsettled and anxious. And when our muscles are relaxed, we're more likely to feel calm and peaceful. And oftentimes we can be carrying a lot of tension in our body and in our muscles without even realizing it until we really focus on it, especially when we're feeling high levels of stress or distress. So this means that in order to feel more relaxed, we need to practice identifying when our muscles are tense and to learn how to relax them. And that's what progressive muscle relaxation does. So I'll walk you through an example here. We'll go through the steps, but broadly what this practice entails is practicing intentionally tensing, so putting tension on purpose in each muscle group in your body in sequence. So you tense up those muscles for about 5 seconds each, and then you relax that same muscle group for about 10 seconds. So that's the broad idea, but I'll go through the steps now. So if you want to do this, I'd recommend, in order to do the full body, it might take between 10 and 15 minutes. So put that time aside for yourself. Find a quiet place where you can sit or lie down. Although personally, I'd recommend you sitting, because I know I've tried to do this lying down before and I've ended up falling asleep, which, I guess is relaxing in its own way, but not the purpose of the exercise. And then before you start, just take 5 slow breaths using that belly breathing that we talked about. And then what you'll do first is tense that first muscle group that you want to work on. So for example, if you were tensing your shoulders, you could bring them up close to bring them up towards your ears, kind of as if you're shrugging, and hold it there for 5 seconds. And I should say that if you feel any pain, this should not be painful. So we don't want to create levels of tension that create pain. We just want to feel that tension or kind of that the muscles becoming a bit harder. So if you know that you have a sensitive or injured part of your body, just skip it and make sure that if you do start feeling pain, to stop right away. So you're tensing your muscles for 5 seconds and you breathe in, and then you quickly relax that muscle group. So for the shoulders, you kind of drop your shoulders down and breathe out at the same time to release that tension, about 10 or 15 seconds. And then you repeat this with other muscle groups. And the way that we think that this works is you're really creating a contrast between the tension and the relaxation. So it helps you kind of get a sense of how your body feels when it's tense and relaxed. But the really important part of this, and the most important thing to focus on, is to make sure you're paying attention and you're noticing the difference between the tension and the relaxation as you're doing this. So this is just an example of some of the muscle groups you could go through, again, kind of keeping in mind if you have any muscle groups that are, painful or that you could skip over those. But how this would work is you would kind of go through each of these from either head to toe or toe to head, depending on what makes sense to you, and sequentially tense and relax each of these muscle groups. And if this seems a bit complicated or like a lot of stuff to think of at the same time, there are a lot of guided practices available on YouTube, and I'll share a couple links that I like later on in the presentation. So that's progressive muscle relaxation. And finally, I wanted to share, finally for the relaxation piece, I wanted to share a few mini relaxation exercises that you can do that are focused breathing techniques designed to immediately relieve tension or stress or anxiety. And they can be done anywhere at any time because you can do it without anyone else knowing that you're doing it. So for example, especially in periods where you feel particularly tense or stressed, so if you're stuck in traffic and you're feeling frustrated, or someone says something that bothers you, or you're waiting for a doctor's appointment and you're feeling anxious and you kind of just need a quick relaxation, then you can use these strategies. So these mini exercises are kind of based around shapes. So you do a guided breathing using the shapes as a guide in your head to remind you of the pattern of the breathing that you're doing. So the first example here is triangle breathing. So you can start at any point on this triangle, but I recommend starting where that little star is. So you would breathe in, so inhale, again, using the belly breathing technique. I recommend 4 seconds, but you can recalibrate that based on your comfort and your lung capacity. So, 3 or 4 seconds can work, less is fine as well, but just intentionally inhaling up the side of the triangle here, exhaling for the same amount of time, and then pausing with your lungs empty for that same amount of time, for 4 counts, for example. And just kind of do that over and over again until you feel a little bit more relaxed. Another variation of this is square breathing. So this is very similar to the triangle, except after you inhale the first time, you're pausing with your lungs full for those 4 counts or whatever you're doing. And then you're exhaling for those 4 counts and then pausing with your lungs empty. So a slightly different approach, but I'd recommend just kind of trying them out, the different ones when you're both feeling calm or you're feeling stressed, and kind of see the differential effects that you might have. And also, again, if you're feeling unwell or dizzy when you do this, maybe just recalibrate the counts that you're using, or just go back to normal breathing and just make sure that you're seated when you're doing this to avoid any issues with that. Okay, so we've talked a lot about breathing and relaxation. So now we're going to talk about mindfulness and meditation, which uses a lot of those same principles, but we're also bringing our mind into it here. So I'm sure many of you have heard the term mindfulness before, so I won't spend too much time defining it, but I really like this cartoon because I think it speaks to how much of the time, much of the day in our lives, we're kind of on autopilot without even noticing. So if you've ever shown up to work or to an appointment or to a family's house without even remembering how you got there, or not really remembering the details of the drive there, or maybe you've had an experience where you're talking to someone one-on-one, and then you start thinking about what you're going to have for dinner later, or like what you need to do when you get home, and then you don't fully hear what the other person is saying. These are all examples of how we can operate through life when our mind is full. So we're kind of caught up in our heads, we don't notice what's happening, and our mind just goes on this autopilot mode that leaves us feeling disconnected from our lives. The other flip side to that is we can choose to be mindful or choose to use mindfulness. So that's the right-hand side of the cartoon here. So this is when you're purposefully paying attention to your experience, your thoughts, your feelings in the present moment, without judgment and without trying to change it. So really paying attention to the here and now. And so in this cartoon, it's really paying attention to kind of, what's happening in nature as this person is walking their dog, for example. Just a slide here about some of the research. It's actually been, there's been exponential research interest in studying the effects of mindfulness, specifically for cancer patients. And there are specific studies for lymphoma patients, but broadly, this body of work just shows that these types of interventions can reduce some of these symptoms of emotional distress or even physical symptoms like pain or fatigue. So what does it look like concretely to be mindful or do mindfulness? It's really a matter of, again, focusing on the present rather than the past or the future, doing this intentionally, and doing it without judgment or evaluation of kind of what pops into your mind while you're doing it. So kind of the traditional way to do this is to, focus on some type of anchor in yourself. So some sensation in your body. A lot of people like to use their breath as an anchor while you're sitting, walking, or lying down. So kind of taking that time. However, I realize not everyone is interested in doing that or has time to, spend some time essentially meditating. So there's a lot of ways that you can incorporate informal mindfulness practice in your daily life. I'll give you some ideas on the next slide. But really the idea here is to turn off autopilot that we talked about, especially on those activities and tasks that we tend to jump to autopilot on. So some examples of how you could incorporate mindfulness into your day-to-day quite easily are on this slide. So for example, you could decide to eat your dinner today. You could decide to eat mindfully. I don't know about you, but I have a pretty bad habit of watching TV or scrolling on my phone while I eat. So I'm not really paying attention to what I'm putting in my body. So for me, one way to eat mindfully would be not to watch TV while I'm eating, and also to really pay attention to the textures, the smells, the tastes of the food as you're eating. You can also practice mindfulness intentionally next time you're doing one of those tasks or activities that you tend to go on autopilot on. So for example, washing dishes is probably a good example where most of us are just kind of trying to get it done as fast as possible and probably thinking about all sorts of things in our head while we're doing the dishes. But you could intentionally choose to, instead of thinking about what you're going to do when you're done or thinking about what happened that day or whatever else you might be thinking of, you could decide to really just focus on the process of washing dishes. So, how does the water feel on your hands? What do the dishes look like? What are the stains on them? What's the grime that you're trying to get out? Things like that. And again, not being too hard on yourself if and when your mind does wander to that past or to the future, because inevitably it will do that. The idea is kind of like training a puppy to walk by your side. You're training your mind to come back to the anchor, to come back to that activity. And that takes practice and patience as well. Then the next thing, kind of the step up from mindfulness, is meditation. So this meditation is meant to refer to the formal practice of doing mindfulness and of meditating. So you're purposefully setting aside time to sit down and focus your mental energy on an object of awareness. So whether that's your breath, whether it's something in your body, whether it's a phrase or a mantra. And typically what we recommend for an optimal meditation practice for cancer patients is 45 minutes a day of meditation, kind of understanding that you would work your way up to that 45 minutes. I think it'd be very difficult to just sit down and do this from scratch. So if you are interested, there are a lot of programs that teach mindfulness meditation. And I have a couple resources at the end of the slides today, specifically about mindfulness-based cancer and stress recovery, which is a program that teaches mindfulness and meditation to cancer patients. But essentially the idea is you're increasing your mental awareness of your thoughts and your bodily sensations and the connection between your mind and your body. So one type of meditation that you can do, which is really good for beginners, is a body scan meditation. So the idea is you're purposefully tuning into your body and noticing that, again, that connection between the mind and the body, and kind of mentally just scanning, kind of starting from the top of your head all the way down to your toes, just scanning your body and just observing without having judgment on that or interpretation, just kind of observing what's happening in your body, what the different feelings are, what those feelings and sensations might mean. And so it's a nice place to start a meditation practice, because you're actually kind of doing something, like you have something to focus on, which is like that mental scanning. And you could start, of course, these are just guidelines. So you could start doing this 5 minutes a day if you wanted to, but the typical suggestion is 15 to 30 minutes a day to start. So it's similar to progressive muscle relaxation in the sense that you're kind of going from one end of your body to the other, but you're not actually doing anything physically, like you're not tensing or releasing your muscles. You're just kind of mentally taking stock of what's happening. So that's one thing you could do. And then I also wanted to make sure to talk about thoughts specifically, because I think I've said that word a lot without really explaining kind of what I mean by that and why that's such an important thing to focus on. So thoughts are, essentially thoughts are stories that we tell ourselves. Some people can often really strongly identify with our thoughts, and we can often believe that we're in control of them. But in reality, they can be, typically they're quite automatic and repetitive. And, especially as you age, you have quite a lot of years under your belt of thinking a certain way. So it creates quite a habit, quite a rut, if that makes sense. So the importance of thoughts is that thoughts can influence our emotional experience. So for example, if I'm thinking before, let's say, as I'm, logging onto this presentation to give to you today, I'm thinking, oh gosh, they're going to think I don't know anything and that I shouldn't be here. Then if I'm thinking that, I'll probably feel quite anxious in response to that. So that's just, a mundane example based on my life, I guess, of how our thoughts can influence our emotions. But, there's countless examples of that. And mindfulness can allow us to recognize when we're having these types of thoughts that are associated with negative emotions, to kind of see the limitations they may be imposing on our lives, and to kind of decide consciously how much we want to focus on them. Because just because we're thinking something doesn't mean it's necessarily real or based in reality. So I think a helpful analogy with this is that thoughts are like leaves on a stream. So, which means you can hold on to them or you can let them go, depending on what they're doing for you. So as you see a leaf going down a stream, you can choose to pluck it out and look at it and pay attention to it. Or you can kind of choose to just let it drift down and out of view. And you can definitely do that with your thoughts too, especially when they are quite distressing or emotionally charged. You can just decide to, and a lot of people will actually visualize their distressing thoughts as a leaf that is gently flowing down a stream. So it's just one example of a cognitive technique you can use that is kind of related to mindfulness. And then I'll just tell you a little bit about some of those other mind-body interventions that I mentioned. I won't go into as much detail about these, but they're just for your awareness. And if any of them seem interesting to you, you can definitely kind of seek them out wherever they're available in your community. So the first is hypnosis. So hypnosis is a natural state of intense focused attention that is combined with kind of a suspension of your awareness of your environment. And the idea is to achieve symptom relief through this. Typically, you would have a therapist guide you through hypnosis, especially the first time, but then afterwards you can do it at home. And you don't lose any ability to control yourself or anything like that, like we see in the movies and TV shows. You have full control over what you're doing and can stop practicing it at any time. But it's just a more very focused and goal-oriented version of guided imagery and relaxation that we talked about before. Then we have yoga, which I'm sure most of you are familiar with yoga. So yoga is translated to mean union. So it's really combining a practice that helps unite the mind and the body. And I'll just say my main point for this slide is that yoga I think oftentimes we think of yoga and we think of someone, turning themselves into a pretzel, and it definitely doesn't have to be like that. It can be if that's what you're interested in, but it can be very simple movements that can be adapted to all levels of ability and flexibility. And there are also a lot of programs for cancer patients or people with chronic illnesses. So that can be a useful strategy to not only spend time in your mind, but also use your body as a tool to improve that connection. We also, one of the mind-body interventions that we also talk about a lot is Tai Chi. So this is a form of a martial art from traditional Chinese medicine, which involves a series of slow and specific movements that are done while you're meditating, so in a meditative way. And really focusing on the movements is kind of the main piece of Tai Chi. And then we also have Qigong, which is also a traditional Chinese medicine practice. It's viewed as a practice to cultivate and balance our intrinsic life energy, which they refer to as qi, and really the practice of aligning your breath and movement. So in terms of the difference between Tai Chi and Qigong, I think Qigong can be thought more so as a specific movement you do for a specific situation. So for example, there's a movement that can help you open your lungs, for example, whereas Tai Chi is a series of movements and you work through them in a sequence. So there's a bit of difference there. And finally, just to mention creative therapies like art therapy, music therapy, journaling. You might be doing a lot of these things already. The idea behind these is you're facilitating creative ways to express your emotions and process feelings. And again, intended to integrate the mind and the body, the physical and the emotional and spiritual elements as well. So you might be doing some of these already, but just to, maybe you hadn't recognized them as a mind-body intervention. And there are people who specialize in teaching people how to do these kinds of therapies. So that's all I had in terms of the actual presentation. I just wanted to briefly share a couple resources. So feel free to take screenshots of this, of these slides if you want to keep any for yourself, keep any of this information for yourself. I'll just start by saying if you're feeling distressed right now or feeling in crisis and you need immediate help, there is help available. So we do have the National Crisis Service in Canada. So there's a toll-free number there you can call. And suicideprevention.ca has a great listing of, you can put in wherever you're located, and it provides you with a listing of different distress and crisis focused services in your area. But as always, if you or someone is in immediate danger, the best move is to call 911. If you'd like to speak to someone professional about this after this presentation, as was mentioned earlier today in the other seminars, many cancer centers have psychosocial oncology programs. They have professionals who are experts in managing psychological and emotional impacts of cancer, people like psychologists, social workers, counselors, and so on. So definitely ask your doctor if you're interested in that. I also put a few links here to different databases you can consult if you're looking for a therapist in the community. I have a list of video clips here to guide you through some of these exercises we talked about, including progressive muscle relaxation, body scan, and a guided meditation. Also have quite a few suggestions for books. Some of them are cancer specific, some of them are not. And then also a couple books specific to cancer and chronic illness about mindfulness and how to implement mindfulness in your daily life. So I'd highly recommend both of these, but maybe starting off with the one on the left here, mindfulness-based cancer recovery. And finally, other resources here that are free and online. So lots of different toolkits for different resources on how to manage anxiety and depression and other negative emotions. And also some smartphone apps that can help you get your mindfulness or meditation practice started. So I haven't used Smiling Mind myself, but I have used Mindshift and AM Mindfulness, and they're both excellent. And Mindshift is actually Canadian, so by Anxiety Canada out of BC. So I'll stop things there. Thank you so much for listening, and I'm happy to answer questions if you'd like to email me after the presentation, and of course right now.
Thank you for your excellent presentation and the expertise and guidance about the mind-body interventions and how they can be employed and utilized throughout your lymphoma journey. I would now like to open the Q&A session. As a reminder, you can still continue to ask questions by typing them into the Q&A section, which can be seen at the bottom of the black toolbar in your Zoom platform. Click submit, and then the questions will be asked in order of the receipt. Looks like we have already receiving some questions. So is there a way to get access through some interventions and programs for free? Is this through the hospital?
Yeah, so if your hospital has a psychosocial oncology program, or even if they don't have a formal program, but they have some therapists there that are available to help with cancer care, then that is covered in most provinces, I believe. In my experience, anyways, in Alberta and in Ontario, it is covered by your provincial healthcare system. Now, if you're going to see a therapist in the community through some of those links that I recommended, typically there's a fee associated with those services. However, some people have insurance where you can, get reimbursed for that fee. But if you're not able to quickly access a resource, like a professional resource, I highly recommend checking out some of the self-help stuff that I shared in these resource slides, because there's a lot of stuff you can start doing on your own, right away if you'd like, while you're kind of finding those services. I'm happy to show those last few slides again as we are talking here. So I'll just flip through them as we finish the Q&A part.
Another question that we received is the feeling of the diaphragm breath similar to or the same as a good yawn with a bit of stretch?
Oh, that's interesting. You know what? I'm not sure in terms of the evidence behind that. I do know that we don't really know in general why we yawn as humans. Like, it's a very mysterious thing. However, I can see how it perhaps has, and I have read that it sometimes has some, yawning can activate that parasympathetic nervous system, hitting the brakes or tapping the brakes. So I can see that it's a similar, it might have a similar function, just maybe different intensity. And I guess the advantage of diaphragmatic breathing is you can do it whenever you want, whereas a yawn, I think you kind of have to wait for it to happen in most cases, unless you watch read a boring book or something.
Or talk about it a lot.
Yes, I'm kind of feeling the urge coming up as we speak.
Another question was, how long after the start of some of these mind-body interventions do you begin seeing results?
Yeah, so it really depends on, there's really no specific answer to that. It depends on so many factors, including kind of how distressed you feel at baseline when you're starting. Oftentimes people who are highly distressed will report a higher symptom improvement more quickly because they're so distressed. They just haven't had many opportunities or ways to manage that distress before, so they notice a big improvement. It also depends on if you're doing kind of individual therapy with a therapist versus a group, and kind of how much you're committing to that process, and how much the biggest part to ensure optimal treatment outcomes or success is really engaging in that home practice and the homework exercises that are assigned to you if you are following a formal program, or even reading some of these books, is to do it consistently is the best predictor of success.
Awesome. And we have time for one more question. When would be the best time to start these mind-body interventions and management techniques throughout my lymphoma journey?
Oh, that's a great question. I mean, I would say a lot of these you can start right away. I think, I don't know if I mentioned this, but these are the types of skills that it might be helpful to practice them when you're feeling calm at first, when you're not feeling super anxious or distressed, because then you'll have them in your toolbox for when you do feel those higher levels of anxiety, and you don't necessarily have the capacity to think about, okay, which muscle am I tensing, or whatever the case might be. So starting them as soon as possible, just, to have them in your back pocket, I would recommend. And also to kind of explore different ones, because, for example, Tai Chi might not be for everyone, or, mindfulness might not be for everyone. So just to give you a chance to try things out, I think it's really beneficial if you are able to.
Thank you. With that final question, we will be closing the session. I want to thank Chelsea for taking the time to share her expertise, as well as I want to thank everybody in the audience who attended. And if you have any follow-up questions, or if we were unable to answer your questions live, please reach out via email to info@lymphoma.ca for more information. As a reminder, this session was recorded and will be accessible in the near future on the Lymphoma Canada website to watch again. You will be sent an email with these recordings and when they are available for you to review. And then, as a final thank you, we greatly appreciate your time and expertise, Chelsea. Thank you for joining, everyone. This is the last live session of the day, and we would like to direct you to the final closing remarks for this conference.
Thank you.